Welcome to Voices of Change, a new podcast on the Healthcare Now Radio. This is our second episode, and I'm Katie Capps, co-founder and executive director of the Get the Medications Right Institute. I'm also the host for this podcast, sponsored by the GTMRX Institute. We're a not-for-profit organization focused on ensuring personalized, appropriate use of medications and gene therapies. We bring together stakeholders from across healthcare who are bound together by the urgent need to get the medications right. Our members include physicians, pharmacists, health IT innovators, drug and diagnostics companies, consumer groups, employers, payers, and health systems. We're all aligned to save lives and reduce unnecessary wasteful costs that result from our current trial and error approach to medication management. Our members are focused on advocating for a personalized, person-centered, collaborative, team-based approach to medication management. The Institute is a catalyst for change by driving the system-wide transformation needed to answer one simple question: is this the right medication for this person? Last month, we talked to two of my good friends, fellow board members, and renowned physicians, Dr. Paul Grundy and Dr. Terry McInnes. We spoke to them to get an idea of the physician perspective surrounding comprehensive, team-based, patient-centered care delivery transformation. So if you missed the episode, you can still listen to it on Healthcare Now or wherever you get your podcast. For today's episode, we'll be focusing on the pharmacist's point of view when it comes to comprehensive medication management and team-based care. I'll be speaking with two GTMRX board members, each with a unique perspective on the topic. So, my first guest, Paul Abramowitz, is the CEO of the American Society of Health System Pharmacists. Prior to joining ASHP in 2011, Dr. Abramowitz worked in hospitals and health systems. He's actually combined practice, teaching, and research throughout his career and has lectured and published extensively, focusing on the effect that pharmacists have on improving outcomes of care and reducing cost, developing new care models, reducing adverse drug events, and expanding comprehensive medication management to the ambulatory setting. Our second guest, Ed Webb, serves as a senior policy advisor to the executive director of the Board of Regents of the American College of Clinical Pharmacy, which is a national, professional, and scientific society of pharmacists providing leadership in clinical pharmacy practice, research, and education. Dr. Webb has more than 30 years of National Pharmacy Association executive experience in the areas of policy analysis, advocacy, and professional affairs. He recently co-authored a new book, Clinical Pharmacy in the United States, a comprehensive account of the evolution of clinical pharmacy and an insightful must-read for anyone who cares about the profession of pharmacy. I'm so happy to have both of them here with me today. Paul, when it comes to medication management, in what way does the interdisciplinary team most effectively work?
The use of medications, including their prescribing, monitoring, and appropriate follow-up, is essential if we are to get the best outcomes from medication therapy for all of our patients and for all Americans. And to do so, it's essential that we deliver interprofessional care, including a pharmacist as the medication therapy specialist on that healthcare team. Today, pharmacists are well prepared and ready to do that, and doing so in many of the hospitals, clinics, and physician offices around the nation.
Paul, what makes a pharmacist uniquely qualified as the medication expert for those interprofessional teams?
Pharmacists today receive a Doctor of Pharmacy degree, and many go on to receive at least 1 to 2 years of postdoctoral residency training and oftentimes become board certified either in ambulatory or primary care or a specialty area in pharmacy. So they're well equipped to become members of that interprofessional team and work to ensure that drugs are prescribed appropriately, administered appropriately, monitored, and that that patient gets the best outcomes of their drug therapy. And after all, this is exactly what GTMRX is attempting to do in an interprofessional fashion. And we at ASHP believe that care today, healthcare, is team-based and requires physicians, pharmacists, nurses, and others to utilize their full expertise in order to achieve the best outcomes of drug therapy. So that's why we were quick to join GTMRX and fully support it when it was formed.
So Ed, let's talk a little about the evolution of the profession from a dispensing role to the role of the clinical pharmacist. After all, you recently co-authored a book on the history of pharmacy.
Well, patients experience their healthcare delivery system and experience healthcare delivery in multiple venues and settings, and pharmacists are almost always in all of those settings. They may not be seen as the typical community pharmacist, but pharmacists in hospitals, pharmacists in nursing homes, pharmacists in ambulatory clinics, and even increasingly now in physician practices are engaged in a range of medication-related activities that help patients optimize their medication use. That's much more than the dispensing process and usually involves consultation, education, collaboration, and other types of activities where the pharmacist, together with the physician, with the patient's social worker or others, helps them achieve maximum value from the use of their medications.
Paul, are new demands on our healthcare system challenging us to deliver care differently? And how does that impact today's pharmacist?
Well, care is changing, and the role of the pharmacist is changing due to the greatly expanded number of medications we have today and the complexity of appropriately treating a patient, whether it's for a chronic disease or acute condition. And this really demands that the pharmacist become a medication therapy specialist, and thus the practice of pharmacy has shifted from the provision of medications to being on every interprofessional team delivering comprehensive medication therapy management so that patients can get the best possible outcomes for their care.
Thank you, Paul. So Ed, from your vantage point, why is it important that pharmacists take an early role in leadership? And how do you see the pharmacy profession evolving?
Well, leadership in this space should be at the heart and soul of what progressive pharmacy practice is all about. The profession has evolved tremendously over the last 50 to 75 years, both in terms of education and training, specialization, the work of pharmacists in team-based care. There is no profession that has more at stake for its future than pharmacy to reposition itself, to more effectively position itself, to be part of the leading team membership group that supports medication optimization. It's not enough just to get the right medicine to the right patient anymore. How do we know it's the right medication? How do we assemble all of the resources and data and information to make sure that this drug therapy is right for this patient and that it's achieving its intended and optimal effect? That's critically important for the profession going forward. Otherwise, its role in healthcare delivery is going to be continually diminished and reduced only to the process of packaging and distribution.
Very interesting, Ed. So then how do we make this happen?
Well, clearly in the healthcare delivery system in which we currently operate and have for years and years and will for the foreseeable future, in many cases, the physician or nurse practitioner or physician's assistant is the clinician gateway to a patient's medication startup process. They're the prescribers. They're the people who start the process of making therapeutic decisions that are intended to help the patient achieve clinical goals with their disease processes and their medications. So they're clearly the gateway. One of the things we need to help do with this institute is help them, though, appreciate that they're not alone in this process, that they have teammates, they have well-qualified clinical pharmacists available to work with them in a team-based environment to help make those decisions, to develop team-based care plans, and then implement and monitor those plans to actually assure that the therapeutic goals that the patient is attempting to achieve based on the team's care plan are actually being achieved. The prescribers, the physicians, the nurse practitioners, are busy in their own realm of clinical practice. They need assistance, they need support in the medication use process to optimize it and achieve the outcomes we want to achieve. And that's what clinical pharmacists in an integrated team-based care setting are there to do. They help achieve those outcomes, not take them over, not do this work as the Lone Ranger, but to work as part of the team to make those things happen for the patient.
Ed, why is the multi-stakeholder collaborative that we formed through the Get the Medications Right Institute important for this work?
Well, I think increasingly the medical community understands how increasingly complex medication-related therapies are in the age of pharmacogenomics and genetics. We now have 12 to 13,000 chemical entities that are available for the healthcare team to use to help patients get better and stay well. And that complexity is a real challenge for every member of the healthcare team. I think an institute that can help the medical community gain a greater comfort level with a team-based approach to rational therapeutics and medication optimization can bring great value to their practices so that they don't feel that they have all the pressure on them of knowing both all the diagnostics and all the therapeutics. Yes, they're actively involved, but having a team member with them, the clinical pharmacist, to help them manage some of those more complex therapies in a collaborative practice approach takes a lot of pressure off physicians if they want to share that responsibility effectively with other members of the healthcare team.
Thank you, Ed and Paul, for your insight. I really appreciate you taking the time to chat with me today. I also appreciate your perspective on these issues. Well, that wraps up today's episode of Voices of Change. Next month, I'll be talking with Allison Hickey on getting the medications right for consumers. Allison is the president and CEO of All In Solutions. She's also the winner of this year's Fed Health IT 100 Awards. She's a retired brigadier general and was a pilot and aircraft commander, graduating from the U.S. Air Force Academy in the first class to include women. She also previously served as the Undersecretary for Benefits in the Department of Veterans Affairs. I also want to thank our listeners. To learn more about what you can do to help get the medications right, please visit us at www.gtmr.org. So until next time, be well.